Okay, so now that we have washed our hands, dried them, gotten gloves on while explaining the procedure to the caregivers or the mother or what have you, um, and speaking in a gentle therapeutic voice, of course, now we can come over to the bassinet and begin our assessment. So, first things that we see when we come here and look, we see that the baby is alert. She's moving around in her little burrito. We see that the suction bulb is in here, which is good, and we can teach how to use this. But first, we're going to notice that there is a loose article of clothing in here, which is a hazard for smothering. So obviously, we're going to get rid of that and educate the parents or caregivers on what should be in the bassinet or in the crib. Also, educating that you do not want to be sleeping with the newborn in your bed or be placing extra beanie babies, blankets, or clothing in the bassinet. It should just be blanket underneath or a swaddled blanket and then the bulb. So now we'll teach how to use this. So teach them that you always are going to go from the mouth first, then to the nose. So you're going to squeeze it and put it in one side of the mouth and let go so it suctions the contents and you get rid of it. Do the same thing on the other side. Then you go to the nose and do the same thing once for each nostril, okay? And put it back in there. So we're going to go ahead and unswaddle her. So this baby came off of the radiant warmer not too long ago, so you can feel that she's warm, but not overly so. So we can feel that her skin is all warm and dry, everything is good. We're going to begin with the head, so we're feeling across the suture lines, and we can feel that they're approximated. And then we are feeling the foramens, the anterior and posterior, and we can feel that they are soft and flat. That is good. The head is a little bit elongated, but that is normal. That's called molding. We can tell the parents that that is normal and not to worry about that, and it will change over time and not too long. So let's go ahead and assess for Perla. We're going to shine our light in there. And while we're doing that, we do see that she has Perla, but we're also looking for that red reflection of the pupils, which is called the red reflex, which is there. It is present. And now we'll go ahead and we can see that the eyes, nostrils, mouth, ears, they're all symmetrical. All features are symmetrical and healthy. We can brush against the cheek, which she turns towards it, which is the rooting reflex, which is great. Next, we're going to go in the mouth to feel the hard and soft palate. Everything is intact and feels good. And while she's doing that, we can feel suction. So that is a positive sucking reflex, which is very good. And we also are watching the nose. We can see that there is no labored breathing, no grunting, no nasal flaring. So everything looks good on that front. Now we're going to move down to the neck. And we can see that there's a little bit of vernix in the skin folds of the neck, but this baby was born at 38 weeks, so that's term. That is normal findings. And we also see that there's no webbing. We can see that her neck has normal range of motion. We're going to feel for the clavicle, which we can feel. There's no breaks. It has good range of motion. Everything's intact and symmetrical. Moving down, we see that the chest, shoulders, arms, legs, they're all symmetrical and equal to each other. That is great. Nipples are equal and intact. Belly button. And we can look at the cord. We see that it is clamped. There's no redness or edema. It's not overly dry. It looks healthy, and that is good. We can move on to the next thing. Looking in the hands and feet, you can see that there's a little bit of acrocyanosis, little blue tinge to the skin, which is normal if the parents are worried about that. While we're here, you can put your finger there and see that she grabs it, which is the palmar reflex. So we've got that. That's good. Do that on both sides. Next, we're going to just go ahead and count each finger and toe. And make sure that she's got 10 of each. And while we're doing that, while we're assessing the feet, we see that she actually has club feet, which is an abnormality. And tell the parents not necessarily to worry about it, but that we need to speak to the provider and talk to them about how this can be corrected. And we will look into that immediately. And then let's go ahead and take our pulses. So for brachial, you're going to put 2 fingers under the armpit area on both sides and sort of press down and get those pulses and see if she's got a good strong pulse there. Now do the same thing in the femoral. Feel those, she's got good pulses. Then dorsalis pedis, and we've got that. Okay. Now let's go ahead and listen to her breathing. Make sure that this is not too cold to be uncomfortable to the baby. Listening to her breathing sounds that are clear to auscultation. Her sounds are clear with no additional noises. Listen to all the sites, ALP. Her up so we can listen to her breathing from the back. Okay. And lung sounds are clear. Again, breathing is unlabored and even. Now we're going to listen to her heart sounds in the 5 sites, which sounds great. Clear to auscultation, rhythmic, regular heartbeat. Now we're going to listen to the full minute apical pulse. And that needs to fall between 120 and 160 beats per minute to be within normal range. Also with counting the respirations for also a full minute, needs to fall between 30 and 60 breaths per minute to be in the normal range. Okay, and while we're here, we see that she's got full range of motion. Everything is moving, is aligned correctly. The hips are equal. There's no dysplasia. Now we can go ahead and remove the diaper. We can see that she has passed a little bit of meconium, which is normal. And there's also a little bit of pink bloody drainage from the vagina, which is called pseudo menstruation, which is also normal. That is the result of the mother's hormones passing through the newborn's body, and you can assure the parents that that is a normal phenomenon. And we can tell that the vagina is not inflamed or has any edema. Everything is correct looking. It's healthy, it's patent, and the placement is correct of the vagina as well as the anus. No irritation. So we can go ahead and pull that back up. Turn her around and feel. You can tell that her spine is aligned and healthy. There's no sacral dimple. She does have a stork bite on the back of her neck, which is a birthmark. That is a normal finding. Put her back down. And let's go ahead and get cap refill. You're going to want that to be the blood to return in less than 3 seconds, which she does in all fingers and toes. Good cap refill, that is brisk. We can assess for turgor, and we see that there is resilient skin turgor, so she's nice and hydrated. That is good. We look for coloring. We see that there's no jaundice, and everything's looking good on that front. And down here, we can do the Babinski reflex. So we'll stroke the sole of the foot, and the toes will flex towards the stimulus. That is a positive Babinski. Lastly, we will get temperature. Babies don't like this, so this is a good thing to do last. We're going to place it under their underarm like this. Press down until you get your temperature. Let's say we got 99, which falls under normal range. She's a little bit warm from the radiant warmer. Get both sides. And now we can go ahead and swaddle her back up. Let's go ahead and tuck one arm. Hold that side. Do the same thing on the other side. Tuck it in like this and tuck in at the sides. And she is good to go.